Okay, so let me tell you a little bit about the Hcg diet. The Hcg diet is the most effective, safest way that I found for patients to lose weight rapidly under medical supervision. In my practice, I started the Hcg diet about 10, 12 years ago because most of my patients coming to me for liposuction to look better were really too big. Liposuction is something to contour the curves. It's not something that makes a large individual smaller. So people wanted to be a smaller size like yesterday. So we started this program to help people lose weight rapidly, safely under medical supervision so then they could get the procedure that they wanted. Well, over the years, a lot of people have used it just to get to a smaller or healthier size. And that's what I'm going to talk to you about in terms of how it works. Hcg stands for human chorionic gonadotropin. That's a mouthful. So that's why we say Hcg for short. Okay. It's a hormone that probably developed in human beings to ensure survival of the species in times of famine when food wasn't available. Hcg is the hormone that is produced by the placenta, the little baby's house. That's what crosses into the mother's bloodstream and shows up as a positive pregnancy test. Okay, pregnancy test check for Hcg in the blood or in the urine. Okay, and then Hcg continues to rise to very high levels throughout the 9 months of pregnancy. Now let's say you were a pregnant mommy crossing the Sahara Desert. The high levels of Hcg floating around in your bloodstream will help pull from your fat stores to feed the baby during that trip when there's no food coming in here. The normal tendency for the body is when there's no food coming in the mouth, the body shuts down, your metabolism slows down, and your body doesn't want to give up those calories. Okay, so with Hcg on board, you're a pregnant mommy crossing the Sahara, your baby survives because there's calories being let go from your fat stores, the baby's born, and human beings continue to live on planet Earth. The way that we use it for medical weight loss is we simulate that scenario, crossing the desert. Now, real starvation isn't healthy in any case. So what we do is we have a very strict, very rigid 500 calorie diet, a low glycemic diet. And that keeps the calories under the radar, so to speak, low enough to fool your body that you're going to starve, but it's enough calories daily, 500 calories, to keep you healthy during the 6 weeks of the program. Okay, so you'll be injecting a small amount of Hcg. It's using little diabetic insulin needles, a fraction of what a pregnant woman would have in her body, and we're afraid to give a pregnant woman an aspirin, so it's very, very safe. People can use it with all sorts of medical conditions. I have patients with high blood pressure, high cholesterol, diabetes. They're able to lose the weight rapidly and maybe even get off their medicines completely. And that's something that you can't do with the amphetamine diet pills that you get at most of the weight loss clinics. So it could actually be dangerous and even deadly in some cases. Okay, so what we do with the program is we put you on this very rigid 500 calorie diet. You're required to keep a journal. The journal is going to be your best friend. You record 4 things in the journal. Number 1, the time. You look at your cell phone, you look at your watch before you get ready to put anything in your mouth. The second thing is to record is the item you're going to eat. Let's say 3.5 ounces of boneless, skinless chicken breast. The third thing is the calories, 166 calories. And then the fourth thing are the circumstances, what you were doing or getting ready to do when you were going to consume the food, because they're creatures of habit. Okay, and what this journal is going to do is going to help us see how you're distributing your 500 calories throughout the course of the day, so that we can tweak some things here or there, make sure that you're feeling good throughout the day, your energy level is good, and that you're getting the most out of the program. Okay, so that's how the program works. The success of the program, I found in my experience, is directly related to the quality of your journal. You'll be bringing that journal in every week. We'll be grading it just like an essay paper, okay? And we'll give you a new set of medications for the week, okay? And after you're no longer getting the shots, after the 6 weeks of the program, you're still going to keep the journal. It's going to be your coach, so it's going to help you stay on track so that the weight that you lose will stay off. Depending on how large people are, people may lose anywhere from 3-4 pounds a week to 7 pounds a week, a pound a day. Okay, so it's very, very effective, but a pound a day is 7 times faster than if you're just doing the right things. If you only lost, the normal healthy rate of weight loss is 1 pound per week. Over a year's time, that's 50 weeks. I give you a couple of weeks off for the holidays, okay? That's 50 pounds. That's a huge amount of weight for any individual. Most people don't do what they need to do day in and day out for 350 days in order to get the results. So what HCG does, it accelerates those results very rapidly, safely, so that you feel motivated, encouraged to continue to make progress towards your goal weights. Okay? Any questions about that? About how the program works? Okay. All right.